Welcome to Philanthropy SA. This is a podcast about and for the philanthropic community in San Antonio and South Texas. We introduce organizations and people who are making an impact in the community. Beneficent Financial is proud to sponsor this podcast, and it is our hope that you enjoy this conversation about the impact we can have. The goal is to edify and inspire. Now please join our host, Dan Redman.
Hi, welcome to Philanthropy SA. I'm your host, Dan Redman, and very pleased to be joined by Erin Ercoline. She is the executive director of ThriveWell, and we're going to hear all about ThriveWell in a little bit. But first, we were reminiscing about Emo's Pizza and
the Provel cheese.
Exactly. And frozen custard. For those of you who aren't getting those references, that just means you haven't been to St. Louis, Missouri, where I was born, and Erin spent a long time as well. So with that out of the way, we now know that you are not a native San Antonian.
Actually, I am. So my dad was in the military, like most folks who have some sort of connection to this city. So I did go to high school down here and then left to go to the Midwest for college and graduate school. So that's how I ended up in the Midwest. I was in Illinois for a little bit and then spent a good deal of time living and working in the St. Louis, Missouri area. So I'm very, very fond of that city.
Indeed. And then came back to San Antonio.
I did. Yeah. I came back to San Antonio about 13 years ago, and really for the job at ThriveWell Cancer Foundation. I was looking to come home because my family's here. I have a brother who has a family up in the north side of Austin and Round Rock, and knew I always wanted to come home to Texas. And I met a boy, and he was interested in coming down south too. He's one of those who isn't from Texas, but says he got here as soon as he could. And so it just worked out. And when I saw the job opening at ThriveWell, it's a cause that's near and dear to my family. And when you do nonprofit work, you really want to be connected to the cause. And so I knew it was something I could get behind.
Sure.
And then I did a Skype interview way back 13 years ago before all of COVID taught us how to do virtual really well. So it was really funny. I did it in our little apartment in Soulard in the city of St. Louis, and then came down and met the board and jumped right in. And so that was 13 years ago.
Very good.
Yeah.
So what was it that made you decide you wanted to be involved in the nonprofit world as opposed to the for-profit world?
So when I was in undergrad, I got to do some psychology classes and some sociology classes. And back then, social work was just kind of coming onto the scene. As a matter of fact, my college didn't even have social work. And so a part of the sociology program was doing practicums in this little farm community where I went to school. I went to this, undergrad in the middle of nowhere in Missouri, Missouri Valley College, and then ended up doing grad school at Southern Illinois University in Edwardsville. Again, the sociology department was where I went, and I was a teaching assistant, and they had an internship program. And I knew that I didn't want to do business work. I had just always been drawn to people and their stories and how people end up in situations that they end up in and what makes a person who they are, their family backstory, all of that. I was always really interested in that. And so I got to do an internship at an organization that provided support services for domestic violence and sexual assault victims. And back then there was really no internet. And so I literally just went through the Yellow Pages, the St. Louis Yellow Pages, and found this organization. And jumped in with them and spent almost 20 years with them doing grant writing, program work. It was, again, a really grassroots organization. And I just knew that nonprofit work was where I wanted to be. Now, that evolution of that work has really, it's evolved greatly over the last 30 years, which is about how long I've been doing it. And so about 15 years ago, I went back and got my MPA, which is a Master's in Public Administration. So there is more, I got some training with government agencies and that sort of thing. So, but knew I always really wanted to work in the nonprofit sector, just trying to make a difference for folks because I have lived an unbelievably charmed life.
Very good. So talk a little bit about ThriveWell and what,
Sure.
What does ThriveWell do and kind of, You moved to Texas to be a part of it. So Tell us about ThriveWell.
So again, ThriveWell Cancer Foundation, we're a super small but mighty organization. We provide super tangible support and programming to cancer patients, survivors, and their families. one of those programs that we provide is our patient assistance program. And for us, what that looks like is we provide financial assistance, transportation assistance, and then lodging assistance for folks who have to travel into San Antonio for their treatment. What we know now is that people make decisions about how they access or if they can even access care based on the financial outlay that's going to come along with that diagnosis and the logistics of even getting to the myriad of appointments that come along with a diagnosis. And so like I mentioned previously, unfortunately, cancer has affected our family. I saw my aunt manage my uncle's care. I saw my grandmother go through it. So, and now I've had countless family members who have had a diagnosis and thankfully come out on the other side of it. But what I know is that the only reason that they were able to navigate their care is because they had access to resources. And so what ThriveWell does is make sure that it's a level playing field. And so folks who may be struggling with all the costs, with the logistics of treatment, we want to make sure that they have access to a safety net that can make sure they access that life-saving care.
And how do you identify who needs this help? And how do you identify, I guess, who your clients
How
are?
people find us?
Yeah.
Yeah. So we have partnerships and collaborations with all the oncology practices here in town, all the hospitals, really any organization or institution that interfaces with a cancer patient at whatever stage in their diagnosis. They know about us. And so we really rely on those partnerships. So then when a patient presents, I just can't do this financially. I cannot make this copay. I will not be able to meet my deductible. I don't want to bankrupt my family. Those folks, like a social worker, a nurse navigator, a nurse, a scheduler, will say, we have an organization that can help you, and that's ThriveWell. And so we really, again, rely on the folks in those institutions, the hospitals, the private practices, the scanning places. Strick is a big referral source for us. To navigate that with those patients. And that's how they come to us. And then we take it from there.
Very good. And then in terms of the services that you provide, obviously you're providing funding and that kind of thing. Mm-hmm. But I'm assuming you're not just writing checks and handing them out.
No.
In terms of, what kind of counseling and, those types, are there case managers assigned? How is that handled?
So we have patient assistance coordinators who are on staff with us. We have a staff of 6. So again, we're a small but mighty team. And so those patient assistance coordinators are working all day, every day, either coordinating transportation, doing outreach with patients, making sure patients have access to not only our financial resources and the transportation and the lodging assistance, but also those other complementary things that need to come along and walk in lockstep with conventional treatment. And these are these ancillary services that really help a patient get on the other side of their disease. And so we have this other program that we call our Diva and Dude program. Mm-hmm. It's a free exercise and wellness program that anyone who has ever faced a diagnosis can take advantage of. And with that program, there are free exercise classes, there's free nutrition classes, there's free counseling, there's free support groups. There's all kinds of ways to get in with a community of people who really understand what that person is going through, because everybody in those classes is either knee deep in it or they're on the other side of it. And so it really has become this amazing support network, huge support network for folks who are kind of just getting started and that deer in the headlights. They form these relationships with these other survivors, and it's as life-changing as being able to pay for a copay or a deductible or a bill that comes along with a diagnosis. So that's our Diva and Dude program. And the reason that program is being offered is because way back in 2007, when we were founded, there was data coming out about the benefits of exercise and nutrition for folks who were going through treatment, specifically breast cancer patients. But now it holds true for everybody who's faced a diagnosis, that if you can move more, essentially 3 to 8 hours a week, and stick to a pretty healthy lifestyle in terms of your nutrition, you're going to cut your chances of recurrence of the disease significantly. And so we've provided this program. That was really our flagship program way back almost 20 years ago now. And so we do that with partnerships with the YMCA. They give us low cost for all of our exercise classes. We have chefs and registered dietitians that work with us about creating an anti-cancer diet that patients can take with them and implement immediately. And the goal of that is really to not only help the patient stay in remission and reduce the chance of recurrence, but also if there are kids in the household, possibly prevent the next generation of getting the disease. And so that's that other support network that we provide in addition to that patient assistance program.
Very good. How many folks are in that program?
The Diva and Dude program, we have about 2,500 on the roster. Anywhere from 250 to 300 every month participate in those exercise classes and the nutrition classes. We do an art project every month. And that's, again, it's really fellowship and community. And so there's healing in art. And so we do that at no cost. And it's all free. So if folks can't afford a gym, if they can't afford a personal trainer, we provide that for them.
If somebody's listening and they know someone with a diagnosis or they have one themselves and they'd like to get more information about how to get that assistance or get involved in the Diva or Dude program, what's the best way for them to reach out to you?
The easiest way to jump into the Diva and Dude program is visiting our website, which is www.thrivewell.org. And on that homepage, you'll see a Diva or a Dude drop-down menu, and you can just click on that. And there's a brief registration form. You go through it. You'll meet with our Diva and Dude program director and take off running, jump in with both feet. But if you have any questions and can't navigate the website, give us a call at the office at 210-593-5949, and you're going to get a live person that you can talk to, not just about the Diva and Dude program, but anything you might need through your journey.
Sure. That's great. Let's talk about kind of you mentioned collaboration earlier and some of the organizations that you've collaborated with. How do you interface with some of the other cancer-oriented organizations that are out there? So
every day we're working with folks to refer back and forth or help patients who have been referred to us. What I can tell you is the national organizations that had chapters here in San Antonio, unfortunately, most of them pulled out of San Antonio right before COVID, and for a variety of reasons. And so in terms of boots on the ground in San Antonio, providing the patient assistance program, we really are it right now. But there are other organizations that might be disease specific. So there's lots of breast cancer organizations that do a variety of things, some other support groups, those kinds of things. And so we're just referring back and forth all the time and working with those folks here in the community.
And you mentioned the fact that organizations support you, but from a funding perspective, if you're going to be paying for these services, where is that coming from?
By and large, we have many, many individual donors and family foundations that give to ThriveWell because they themselves are connected and have a story of their own and know that because they were resourced and had what they needed to get through their treatment, their story is they're still here. And they want to make a difference for those who are struggling. And so we've been so blessed with those folks really since the inception of our organization. And many folks just want to make a difference because they know the challenges that come along with a diagnosis. We get some grant funding. Methodist Healthcare Ministries is a big supporter of our organization. Baptist Health Foundation of San Antonio is a big supporter of our organization, the Kronkosky Foundation. So we do get some grant funding, foundation funding, and lots and lots of fundraisers. We do. October is super, super crazy for us. We just came off of a golf tournament, a 5K, a gala, all the things. And really what's come out of that is because October is Breast Cancer Awareness Month, it's mostly women who are activating around friends and family who have gone through a breast cancer diagnosis. But ThriveWell is not diagnosis specific. Anyone who has faced the disease can take advantage of our programs. But our funding comes from a variety of places. In addition to the fundraising and the grants, we do get Rebecca Clay Flores, County Commissioner, helped us with some funding for transportation. She herself went through a diagnosis and, again, understood the challenges. When she was not feeling good, she had friends come in from out of town to take her to her appointment. And so she earmarked some funding for us to provide transportation to her constituents. So it comes from a variety of places, but by and large, it's individuals who just get it and they understand our mission.
Yeah. So, I hear you talk about where your funding sources come from and everything. It's kind of that classic braided income stream.
For sure.
That, we know. And given what's going on in terms of certain federal funding and that kind of thing. Some organizations are really struggling right now with their historic or traditional means of funding. And so I think that the notion of being able to access funds, from multiple different places, and particularly when you said large base of small donors, that's a huge thing that does that. You mentioned that obviously people will, have a firsthand experience with the disease or a family member that has an experience with the disease. What else do you do to kind of develop those smaller donor relations and encourage people to do that?
Great question. So we really try to not expect the patients who are benefiting from our services to give back. Everything's free. But what we do try to do is educate them, because they all have social circles and have influence within their own families and friends, that if they feel like they want to help, because so many family members and friends want to do something when that person's going through treatment. And most of the time, there's very little you can do other than cook a meal, provide prayers, just be a sounding board. People want to activate and try to do something to help. And so we educate our patient and beneficiaries on, if those folks are asking you, think about making a small donation to ThriveWell. And that's really sort of the entree to learn about us. And then once they find out about how many people we're helping, but then all that we provide, they really, really get the importance of what we're doing. And then they stay with us, which is really wonderful. A great example of that is the San Antonio Fire Department did T-shirt sales this fall, and they selected us. Now that choice goes through their union board. And so what ended up happening was, when they were selecting an organization to be the beneficiary, they had a couple of their firefighters contact them and say, you really need to consider ThriveWell. They had already been talking to us, but what they didn't know was that a couple of their firefighters had used our services and were dudes. And so we had this instant testimonial from people who they wanted to hear from. And it was kind of a no-brainer for them. But that is going to result in funding for us that's going to make a difference for other patients. So that's normally what we try to do. And then we have a fantastic board of directors. Again, all of them are connected to the cause, and they do not shy away from sort of using a megaphone to blast out what we're doing in the community and how much we're helping people. And they really leverage their relationships to help more. So it's wonderful.
Well, that's beautiful. So we can kind of start getting into some other types of questions. I mean, anything else you want to talk about ThriveWell specific?
Really just encouraging anybody who's out there who is struggling or knows folks who are struggling here in our community with a diagnosis, please call us. We are here to be of service to our community. And our mantra, we have 3 survivors working for our organization. 2 of them are the patient assistance coordinators. So we get it. And when you call us, you will get a live person on the phone, and we will figure out how to best engage with you and help you and form that relationship that will hopefully make things better for you and increase your quality of life.
Absolutely. Make that impact, for those families that are going through that. So the question that comes to my mind is, when you're bragging on your board, which is great. That's
so lucky.
That's a beautiful thing to hear. But I know, just from conversations with a lot of, CEOs and executive directors over the years, board engagement and board involvement and that type of thing can be a hit or miss thing, or something that, not everyone is blessed with that level. I guess, to what do you attribute that, and what have you done as an executive director to kind of, help in that board engagement and keep them focused on the types of things that we all would hope that they'd be focused on?
Sure. So we have the benefit of having our organization was founded by 3 women. All 3 are still engaged with the organization. 2 are still active board members. One, her name's Dr. Amy Lang. She is a practicing oncologist here in town. And then the other one who's still engaged with us is Lynn Stahl. And she is really active in the community. And so what I have found is that their expertise, their personalities, their commitment to the cause has drawn people in to want to be a part of our organization if they have a cancer story. And unfortunately, most people do. And it's just amazing what happens around the table with these brilliant minds. There's such a varied group of not only physicians, but community leaders, executives at HEB, insurance folks, lawyers. The commonality is they all have a cancer story, but their varied experience has really taken our organization to the next level. And quite frankly, sometimes I just support what they're doing in terms of the communication, what they want to see happening. And I'm feeding them the information that we're getting from patients. So we make sure that we're providing what those patients need, not what we think they need. And 6 of our board members are cancer survivors themselves. So they really get it. It's really, I say this all the time, and I think that they know this, that it's a very unique board. Not a lot of boards operate the way ours does. And I'm so lucky.
Well, that is good to hear in terms of, for you, I think the part about not too many boards are like that. That's the bad news for some organizations that would like to see some more, increased levels of board engagement. But I think your point about founders being still involved, has a big role in that, or a big impact relative to that. And certainly, if they're seeing it firsthand. And so, I don't know too many people that don't have a cancer, story. I'm a 2-time survivor myself.
So glad.
Yeah, me too. But, and in the back of your mind, you always are thinking, okay, is strike 3 coming?
For sure.
Kind of thing. And that's the challenge there. But I'm glad to know that there's organizations like ThriveWell that are out there that are helping people get through this. In terms of the things looking forward, as you look ahead, what are some of the bigger challenges or that type of thing that you're anticipating coming up, or things that you're trying to prep for?
I think the biggest thing that we're all, and not just with ThriveWell, but everywhere, is the ACA changes that are coming. I think that is going to have a significant impact on how patients either access or do not access their care. And the unfortunate thing with that is that we have come so far in terms of treatment advancements, and people are living with stage 4 metastatic disease 13, 15, 20 years. I mean, that was unheard of even 20 years ago. It's remarkable what is available to folks now. And our biggest concern is that people will not be able to afford their insurance, and they will simply not have access to face a diagnosis that is completely survivable at this point because they won't have coverage. And so that's the big thing that is keeping us up at night right now. We know that our jobs are going to get a lot more intense around the fundraising, because we're going to have to raise that much more money to just get people to be seen, potentially. I mean, there's just so much unknown still about what's going to happen. And so we're bracing for it, and we're trying to plan, and we're trying to get creative about diversification of funding and all of those things that good nonprofits try to do to stabilize. And thankfully, we are super stable and we have a great foundation. But, the unknown about that issue in and of itself is really paramount right now for us. And we're an organization. I can't imagine what that feels like as a family who sees their premiums increasing by 600%. And how are you going to pay the bills? And that's without a medical crisis. So when that medical crisis comes, like a cancer diagnosis, people are going to choose not to get care because they simply can't afford it. And that's really, really unfortunate. And so that's the big challenge that we're facing, I think, moving into next year.
And that's the gap that your organization steps into, which is good. But sounds like what you're saying is that there's going to be more need down the road than what you are currently able to furnish. Yep.
And so even we've experienced this since really coming out of COVID. There was a ton of support available for folks during COVID in lots of different ways. But what has happened with insurance plans, even with the best of insurance plans, more and more costs are being passed on to us, the consumer. But that was with coverage. And so without any coverage, those healthcare costs are going to stay where they are. They're not going to come down. So if you don't have any coverage, you're just not going to be able to access any kind of care without some help. And so that's what we're really trying to figure out. What is that going to look like for us?
So what is anything that I failed to ask you that you wanted to talk about today?
I can't think of anything. Just thank you for doing this. I'd really want to share our appreciation for helping publicize the good work that's being done in the community, not just in the cancer space, but all over the community. I think San Antonio has this really vibrant nonprofit sector that does so much good work in all facets. It seems to be that if you are facing a crisis of any kind, there's an organization out there doing the work. So just get involved and get engaged.
Yeah, one thing that I've heard over and over again from guests, sometimes when we're recording and sometimes after, is just the generous nature of San Antonio.
Mm-hmm. Yep.
And that, the community really rallies
for sure
to help organizations. And that's probably a good note to end on today.
Yeah.
So Erin, thanks for being here.
Oh my gosh, thank you. It was my privilege.
And we're glad you're here. And so on behalf of Philanthropy SA, this is Dan Redmond reminding you to do well so you can do good.
Thank you for joining us at Philanthropy SA. We hope you found something to inspire you during today's conversation. If you know organizations and people who are making an impact in the community, we would love to hear about it. Until next time, do well so you can do good.